So, how do you decide if you need a lift or not if you're having breast surgery? So, there's no simple answer to this question, unfortunately, but I'll just give you the things that I look at as a surgeon to figure things out. So, the first thing to do is determine the degree of ptosis, so how droopy the breast is. If your nipple is where it should be, no ptosis. If it's at the level of your crease, that's grade 1. If it's lower than the crease but still not on the bottom portion of the breast, grade 2. And if it's pointing south, grade 3. The other thing to look at is something called pseudotosis. So this is where the nipple's sort of where it should be, but the breast tissue itself has fallen. So once you figure out exactly what's going on with the breast, then you can figure out what we need to do to make things look different. It's also important to find out from the patient whether or not they want more volume, because sometimes adding volume to the breast will kind of cheat a lift. It doesn't truly lift anything, but it'll make things look more lifted by distributing some volume up higher. So for me, I always find out from the patient, number one, what is their aesthetic? Because there's some patients that they tolerate no drooping. And so even if they're borderline needing a lift, that's someone I'm gonna tell they need a lift. And also, some people, the opposite, they really like a little bit of droop to the breast. And so there's someone that I'm probably not gonna offer a lift to because their aesthetic is different. So in general, if we're not taking into consideration you as the patient's desires, this is just, based off of how things look and the numbers. Grade 3 ptosis, we're pretty much always going to recommend a lift. Grade 2 ptosis, pretty much always recommend a lift. Grade 1 ptosis, maybe. And then pseudotosis is a whole other animal, and I'll shoot another video about that.